In this Dragon Ambient Experience workflow video, or DAX for short, you're going to see how a cardiologist documents care for multiple patients. DAX and Dragon Medical One can be used in a variety of ways to document care before the visit, during the visit, and after the visit. In preparation for seeing your patient, you can insert your own template in the EHR, and DAX will modify it. If your patient requires pre-encounter documentation hours or days ahead of the patient arrival, use Dragon Medical One to enter the relevant information.
The patient is a 73-year-old female with a past medical history significant for hyperlipidemia and breast cancer who is referred for newly diagnosed atrial fibrillation.
To use DAX, select the patient from the DAX app just before entering the room and begin recording the patient introduction, visit type template, and other medical content.
John Smith is a 55-year-old male with a past medical history significant for hypertension and diabetes who is referred for a newly reduced ejection fraction of 35%.
Once in the room, conduct a natural conversation with the patient while verbalizing the pertinent medical content.
So your doctor referred you here because the pumping function of your heart is a little low. Were you aware of that?
While the provider is in the exam room talking with the patient, DAX is capturing the conversation, creating a transcript of that conversation, and converting it into a clinical note. The transcripted note and audio recording of the encounter is happening in the Nuance AI Cloud. A dedicated quality documentation specialist reviews the note, makes any necessary edits, and places the note directly in the EHR for the provider's review and signature.
All right, well, let's go ahead and we're going to do a quick physical exam, okay? Okay.
There are two ways to do the physical exam. The first is to verbalize every exam finding as you are examining the patient. You'll see that now.
No carotid bruits appreciated. I'm going to be listening to your heart now. Heart is regular rate and rhythm, no murmur appreciated.
The second way can be done during or after the patient visit. Verbalize the exam template to use, and then only the exceptions to your predetermined defaults. For example, you would say, insert my normal physical exam template. The abnormal findings are X, Y, and Z.
So overall, Mr. Smith, all of that looks really good.
When you get to the assessment and plan discussion with the patient, the more explicit you are, the better DAX will capture it. Verbalize each problem and the corresponding plan. Additional details may be added after leaving the room. Enter orders and diagnosis via your existing workflow and prepare your visit summary.
Do you have any questions, Mr. Smith?
No, none at this point. Thanks, doctor.
Add to my assessment, we'll refer for cardiac catheterization and possible cardiac MRI along with referral to electrophysiology for ICD placement.
Now you're ready to meet with the next patient. Let's see who's next.
Ms. Lee is a 45-year-old female here for follow-up for her atrial fibrillation. Hi, Ms. Lee, how are you?
Good.
Are you able to enjoy this beautiful weather we're having?
Yes, I've been loving it.
You'll get a notification when your notes are ready for review. Review the note, and if any edits are necessary, type directly into the note. You can also edit the note with dictation and add to the note after the patient's date of service with Dragon Medical One. Use the virtual assistant voice commands to further streamline your workflow.
Hey, Dragon, show me the troponin.
As you can see, the Dragon Ambient Experience provides a seamless workflow experience, saves you significant time, and enables you to focus on your patients.